it's Naresh the orthodontist here, and today I'm going to offer some advice with managing problems associated with fixed braces. Commonly, food gets stuck between teeth, and when food becomes stuck, this can be both embarrassing and in some cases a little bit uncomfortable. I suggest using a conical interproximal brush as shown to clear around the brackets and wires. Do not point the brush towards your gums as this may result in trauma. Rather, point the brush away from your gums. Even better still, add a gentle curve to your interproximal brush to enable easy and effective cleaning as shown. Some patients prefer water flossers. This can be quicker and still as effective as part of a regular cleaning routine. You can also tie a knot in some floss to dislodge food particles. Effective, but requires some degree of dexterity. It is important to clean between your teeth with floss, and more patients are turning towards water flossing. But most research shows that interproximal cleaning with well-fitting interproximal brushes is the most effective way of cleaning. Left unchecked, food and plaque will result in harm, resulting in white spot lesions caused by enamel surface softening. This can progress to permanent marks and more seriously result in dental cavitation. Ligatures can commonly come off. Ligatures come in two forms. Tiny rubber bands, these can come off part of your brackets, but can be normally left until your next visit. If the rubber modules completely come off the brackets, again, these can also be commonly left to your next appointment, but contact the practice and gain some advice. Elastic power chain can come off or often snap altogether. If you have an appointment soon, this can be left, but if you don't, it's better to contact the practice again. Discomfort is a common issue with fixed braces. This is universal when you first get your brace fitted, or often retainers fitted too, and presents itself as a dull ache, often needing little more than light analgesics, such as something you would take for a headache. On average, discomfort peaks at around 2 days, returning to normal by the third. However, for some patients, this can be more significant, and the duration of discomfort can also be longer. At brace adjustment appointments, there can also be a slight increase in discomfort, which on average lasts a day and often doesn't require any analgesics at all. Braces can also rub on the inside of your lips and cheeks, and especially when you have these first fitted. My advice here is to use warm salty water mouth rinses to hold the warm water inside your mouth for around 10 to 20 seconds and repeat this a few times during the day. Orthodontic wax can often be placed around orthodontic brackets or coil springs if they are rubbing. Take a clean piece of pea-sized orthodontic wax, rub it between your fingers until it softens. Dry the area around the brace with a tissue, remove the tissue, dab on the wax and cover the bracket. After eating, replace the wax with a clean application. Protruding wires. If wires from a stainless steel ligature, often called pigtails, these can often be pushed under the main arch wire with your fingernail. If the main arch wire is protruding from the end, then you can place an orthodontic wax ball over the end as we've previously described. Please resist the temptation to clip the arch wire yourself. Often the equipment you use is not clean, and further, clipping the wire may risk in small pieces of wire being swallowed. Better to seek advice from the practice. Pieces of wire swallowed. This rarely happens and can be alarming. If you find that you are coughing and have difficulty breathing, contact your orthodontist immediately and seek help urgently. Brackets can often be swallowed, but these tend to pass through without any event. But again, always seek advice from your practice. I hope you find these simple tips in how to manage the common issues with fixed orthodontic braces helpful. Thank you.